today we have with us Dr. Bapu Jena, who is a professor at Harvard, but at the same time he pursued a PhD in economics from the University of Chicago. So to start us off, what motivated you to pursue a PhD in economics and a medical degree? How would you say this differentiates your insights from those of a traditional economist?
It was sort of by chance. I always knew I wanted to go to medical school, um, and I knew I wanted to do research, but I wasn't sure what kind of research I wanted to do. And when I was an undergraduate, I went to MIT, which is in Boston, and I worked in a lab, a research lab, basic science lab, doing biology research, and was planning to do an MD PhD in the basic sciences. And when I had gone to the University of Chicago to interview, this is around 1999, so it's a while ago. The director of the MD PhD program at that time said to me, he's like, "Oh, look, I noticed you studied economics in college as well. Uh, would you want to do your PhD in economics instead?" And so he just asked me that question one afternoon during my interview, and I said, "Sure, I'd consider it." And so he literally set up meetings that afternoon with people in the economics department at the University of Chicago. I went over there, met with people, and a week later I applied. And a few months later, I was taking anatomy at the University of Chicago in the summer, and then in the fall of that year, I started taking the economics coursework, and the rest is history. So it's quite a bit by chance that I ended up here.
Interesting. And so your experience having studied PhD alongside medicine, how would you say this differentiates your insights from those of a traditional economist?
I think it just makes me a lot better. No, I'm just joking. No, no. I mean, there's benefits in the. Oh, hold on one second. I apologize. This would be
No
nice
worries.
fodder for, yeah. That was my alarm to remind me to join you for the podcast day, in case you're wondering. Um, so I think there's benefits and cost to this sort of combined background, both for medicine and for economics. So on the economic side, because I spent a lot of my time and did spend a lot of my time doing medical work, clinical work, um, I wasn't able to sort of specialize in the ways that other economists might specialize in particular areas, though I would consider myself to be a health economist. But I think on net, it's actually been beneficial because a lot of the ideas that I have come from things that I see in the hospital or seeing patients or just being familiar with how healthcare operates. And so it's totally possible that I would have had those same ideas had I not been trained as a doctor. But my own instinct is that the medical training has been beneficial in that respect. And then there's a reverse question of, well, does being an economist help me whatsoever in my clinical work? It probably helps in some ways in terms of the way I think about clinical problems, but it probably hurts in some ways because I spent a lot of my life training to be an economist and still do a lot of research, obviously, in economics. And that time is not spent seeing patients. So there's trade-offs and all of those things. But I think on net, it's helped me a lot.
100%. And when you think about doing clinical medicine and at the same time doing research in economics, you often refer to yourself as a creative investigator. And we see this pattern in your questions you explore and your methodology and looking at big data, natural experiments, stuff like that. So, what is your creative process and why is it important?
No, well, first of all, I don't want to refer to myself as a creative investigator. I think Ted Med refers to me as a creative investigator, which I'm not going to disagree with them. If they say nice things about me, I don't want to disagree with them. But my general approach is this. Let me take a step back for a second. If you look at people who do work that is really creative, whatever the field is, whether it's in economics or medicine or chemistry or literature, whatever it is, I think there's a sense that these people who do this really creative work are just creative people, that there's something innate about them that allows them to do work that is just different. It's novel in some way, and that could be true. But there's an alternative view, and that's the view that I would take, is that, look, that it's possible that some of this creativity is innate. There's just some really clever and creative people out there. But I also think that this stuff can be taught and can be learned. And I think it's a skill that can be honed. And I say that because we can teach people to do very complicated things. We can teach people to transplant organs from one human being to another human being. So how is it then that I can't train someone or teach someone to be more creative in the way they think about problems? We spend a lot of time in education at all levels of training people how to solve problems. So you'll learn strategy, you'll learn statistical tools, you'll learn experimental techniques, all sorts of things that train you how to solve problems. But we don't spend a lot of time teaching students how to conceive, come up with the most interesting of problems in any field. And I think that's an area where we as in academics could do a lot better in, is just to help people understand how to come up with ideas. And I'll just tell you the process that I use, and it's maybe not the only process, I'm sure, but we spend probably a few hours a week solely dedicated to coming up with ideas. I have a group of people that I work with, and we meet a few times a week. And at the start of every meeting, every call, I'll just say, all right, who's got some new ideas to talk about? And most of the ideas we talk about are not good ideas, including my own. I'll be perfectly honest, but that doesn't matter. All that matters is that you once in a while have one good idea, and that's sufficient to make a difference. And so we just sort of treat that idea generation process as in the same way that I would train myself to learn a new programming language or to learn a new spoken language, whatever it may be.
Interesting. And if I would like implement it practically, how often do you have these sort of meetings? And in these meetings, do they follow a certain agenda, or are they like more ad hoc?
Yeah, they are a little bit of both. So we have these meetings probably about 3 times per week, and we will talk about ideas. Usually there's about 2 or 3 ideas that we talk about. And what often happens is someone will talk about an idea, and we'll just sort of like riff off that and come up with related ideas. One thing that I used to do a long time ago, I don't do it anymore as much, is I would read things like Yahoo News, uh, magazines, which you're in the UK, so there's sort of these like kind of tabloid type magazines. At the store, I'd pick them up and I'd look at them, not because I wanted to learn something fundamental about the world, right? But because it's a source of ideas. And one thing that I try to do is be very how would I put it, be very sort of focused on the idea that there's ideas all around me. So like, for example, we're on a Zoom call right now, right? And I'm looking at your background and I see that you're in a room that looks like it has a glass wall around it. And if you said to me, Bapu, what's the first idea that comes to your mind seeing you here? I would say, well, I wonder whether or not rooms that have glass facades lead to more or lower productivity, right? Because people can walk by you right now and see what you're doing. They see you're working hard doing a podcast, right? It's the hardest work one could do. And maybe that makes you more productive. But maybe a little sleep at work would also help your productivity, but you can't do that now because people can see you napping. So I mean, this is just sort of spitballing here, but I think there's ideas all over the place. And we just don't spend a lot of time trying to come up with ideas.
Interesting. Now, I just want to pull into one of the ideas you had and a research paper you wrote. So your paper, Lost Tossings, on gender discrimination in medicine, revealed a very striking $2 million pay gap between male and female physicians over their career. You find that some of this gap can be explained by differences in how men and women present their research. So can you just elaborate a bit more on how you came up with this idea and what were the consequences of this research?
Yeah, so there's actually two pieces of research that are going to be described in your question. So I'll start with the first. The first is some work that I and a lot of other people have done trying to document uh, the gender wage gap in medicine. Now, this is an issue that a lot of economists have thought uh, quite a bit about. What is it like? Observably, we know empirically that there are differences in earnings between men and women, and there's a large question as to why do we observe that? Is this a function of labor market discrimination? Is this a function of intentional differential investment by men and women into educational opportunities or specific fields that compensate more versus less? Lots of different things. Lots of different things could explain it. One thing that we have appreciated, or that I think I've appreciated about medicine, is that in medicine, we have access to a type of data that most other people don't have when they look at other occupations. So in medicine, we know the currency of income. It's how many patients you see, what types of procedures you perform, how much clinical revenue you bring in. If you're an academic physician, it's how many papers you write, how many clinical trials you run, how much funding you have from grants, like from the National Institutes of Health, what your specialty is, how many years of experience you have. Because of the data sets that are available in medicine and that we've had the opportunity to work with, we can actually control for a really rich set of factors that I think is very hard to control for in other industries. So how would you look at gender differences in income between in consulting or in business? How do you account for all the different factors that go into compensation? Well, in medicine, we actually have a lot of this data that we can put together. And we've found that even if you do this sort of detailed adjustment, you find about a 15% wage gap between men and women, accounting for all these factors. If you accumulate that over the course of the careers of physicians, that comes to about $2 million. So it's not a small amount of money. So that's the work that we've done. And you mentioned the phrase lost housings. That's actually based on a paper, an economics paper by Raj Chetty and others, where they termed the phrase lost Einsteins. And they're referring to the idea that we may see lost investments by inventors because of differences in socioeconomic status and access to sort of inventive capacity. Well, here what we're talking about is a little bit different. We're referring to a woman named Helen Taussig, who was an important scientist that was responsible for important cardiovascular surgical innovations. And we termed this paper Lost Taussigs because what we were interested in is, okay, because of the systematic differences in the way that we compensate and reward men and women in medicine, how many fewer Helen Taussigs will we see because of that sort of policy that we have? It's an implicit policy, but how much less innovation from female scientists, female clinicians in medicine would we see because there are systematic differences in incentives? We obviously focus a lot on incentives and how they impact behaviors, and one area is innovation and innovative activity. We think about that a lot in economics. So that's what the concept of lost Taussigs refers to.
Incredible. So building on this point, I want to dig a bit deeper into the field of medicine. And the common and unfortunate phenomena right now is physician burnout. Why do you believe this is on the rise today?
This is an area a lot of people have thought a lot about. Actually, I would suspect that this issue of physician burnout is not just specific to the U.S. I think it's probably quite common in most countries. I'd say in very recent years, the key drivers are going to be related to the pandemic. There's some other indications that the nature of physicians' work has changed. So there's a lot more time spent with clinical documentation in electronic health records, less face-to-face time with patients, things that are required of physicians from insurance companies, like we call them prior authorization. So if a doctor wants a patient to be on a drug, sometimes they have to do a lot of paperwork to make that happen. And that can be frustrating, I think, to physicians. There's a question about whether or not sort of the increased volume of patients seen by physicians over time could contribute. Certainly could, if physicians feel stressed. So I think those are some important reasons for why physicians describe higher levels of burnout now than in the past. I'll just say a second point, though, which is always sort of been puzzling to me, is that we talk about burnout in medicine, But we don't talk about burnout as much in other occupations, which are arguably um, more or certainly as difficult. So, for example, a person whose livelihood is comprised by, cleaning, that's what they do. Um, we don't write papers about burnout in that group of people. And clearly, the compensation that they would receive compared to physicians is a lot less. The way that society might view their work is different, unfortunately. But we don't talk about burnout in those groups. So I've always been interested in what is it specific that the physicians or lawyers or whatever more sort of specialized work we're talking about, where we talk about issues around burnout. I think it is important to sometimes step back and say, look, burnout is not just a problem among people who have PhDs or MDs or law degrees. A lot of people struggle with these issues of work-life balance and satisfaction at work. And we should really be thinking about the whole spectrum of occupations, not just the ones that are quite privileged, like the ones that I am in, or that you might be in the future.
And you've pursued an unconventional, one could say an unconventional career path. How would you describe, so what advice would you give to someone who is a student and trying to carve out a similar career path for themselves, which doesn't really fit any buckets per se?
I would say do what you like doing. Um, expose yourself to different opportunities. If you're interested in economics, then talk to a lot of economists, talk to students who are studying economics, familiarize yourself with the types of work that people are doing, and really maybe only get into something if you really enjoy it, if you feel like you're passionate about it. um, I think about students who are kind of contemplating careers in business or law and things like that, and those fields have a lot of benefits. First of all, depending on your interest, that work can be extraordinarily fulfilling. But what is also true is that work tends to compensate very well, and sometimes students are attracted to those fields because of the compensation that might occur. Or same thing is true in medicine, in fact. But there's a lot of other stuff that comes with a job that compensation can't solve, problems that money won't solve. So I think it is really important to just say, all right, what is it that I enjoy doing, and how much am I willing to give up to do something I enjoy doing? Um, and I think just exposure is key to all of that. So, I get emails from high school students who want to chat. So I'll chat with them for like 15 minutes and tell them what my day looks like.
Yeah.
And I tell them you should talk to somebody else for 10 minutes and ask them what their day looks like. And then use that to sort of figure out what you might want to do.
Interesting. And so I just want to bring on to another project that you do. So you host a very popular podcast called Freakonomics MD, where you once stated expertise matters when the person receiving the information has no expertise. What do you see as the benefits and risks of media platforms in disseminating academic insights to a wider audience of non-academics?
I think it's useful. Certainly as someone who writes papers, I don't want to be in a world where I write a paper and nobody hears about it. It's like, if a tree falls in a forest but nobody hears it, did the tree fall? It's like the story the joke you'll sometimes hear. So I think there's it's very useful for academics to be able to connect with media and other platforms, social media, for example, to disseminate work. So I think that is invaluable. Um, I think we've seen during the pandemic that there's a lot of appetite, at least for research related to COVID-19, but there's a lot of appetite for scientific information. People who perhaps would not have conventionally thought of themselves as having scientific interests, you see on social media now having a lot of interest in studies. Sometimes it's misguided, sometimes it's not. But my general view is that's a good thing for people to be more engaged with what's being studied and what people are working on. Uh, there is a separate issue of how to convey information correctly, how to I think the two big issues are how to make sure that what is being conveyed in a causal way is in fact causal. So, for example, if there's a number of media outlets that report on an association between sunlight and Alzheimer's disease, Is that a causal association? Probably not. I would say probably not. So, it might be helpful for example, for articles to be explicit about that and to explain what the study shows and what it doesn't show. Or I might even argue in some cases, it might even be useful if the article doesn't even exist in the first place, both for the researchers who wrote it and for the media who then decide to cover it. So one issue is just sort of like talking about what a study shows. And then the other thing I think is important in the communication process is to talk about what can you generalize from what a study shows. So it's often the case that we'll take a small study, maybe it was well conducted, and generalize a lot out of it. And sometimes that's not appropriate. So I think that's another sort of second pillar where I would be thinking about communication, excuse me, communication failures. But in general, I'm supportive of the idea that academic work should find its way into the mainstream.
And when you personally think about academic work for yourself, do you do you perhaps gravitate towards ideas which have a more mainstream understanding of per se, right? Like that are more applicable to a mainstream audience, or would you perhaps be more open to ideas which are very niche within the topic?
I would be open to both. Historically, I have focused more on the former, though not exclusively. Some of the stuff that I do is going to be specialized that general audiences wouldn't be interested in, I would guess. But most of what I do falls into the category whereby, if I was walking into a grocery store, I could tell somebody, oh, you know what? Do you know why kids who have August birthdays are more likely to be diagnosed with ADHD? And they probably would be able to figure it out with a little bit of back and forth. They have no background in medicine or economics or even the sciences. So I am personally attracted to ideas that have general interest,
Hmm.
um, and that have some kind of degree of cleverness or creativity associated with them. That's just the sort of stuff that I like, but not everybody's like that. In fact, many people are probably not like that. And so but it's what I like doing. So this goes back to my earlier comment is, this is the kind of work I wanted to do. Um, I wasn't sure whether it would quote unquote pay off or not. It's hard to know that. It has, and it has worked for me, but it was not obvious that it would have been the right approach to take. Um, but I did it anyway.
So in retrospect, what guided the decision to make that sort of leap of faith to continue with this path when it was quite uncertain whether it would pay off or not?
Well, I'd say two things. One is I had exposure to people who are doing this already successfully. So that's really important, because I saw that there was a path that others had taken, not in medicine, but more in economics, and so that was important. The second thing is that I enjoyed it. So, these papers, these studies, they take time to do, and the process of getting an article published by a good medical journal or a good economics journal or health policy journal can be painful for a lot of different reasons. And so you have to enjoy what you're doing to do it. And the third thing is, I'm not a fool. I got lucky early on. Lucky maybe is not the right word. I was fortunate early on that these studies attracted attention. They were published in places that I wanted to publish in. And so I saw and I realized early on that this wouldn't be a fool's errand, that I might be able to do more with this. If I had years and years of no success at getting this work published and people hearing about it, then I probably would have done something different.
Interesting. I want to move back to medicine, the medicine research within medicine a bit more. There's a very prominent discussion at the moment with the overturning of Roe v. Wade, which has reverberated across the world. How do you think it will impact the efficiency and equity of American healthcare system? And do you foresee a rise in defensive medicine as a result of it?
Yeah, I think it's to be decided how it's gonna impact people. It's certainly going to impact people. There's no doubt about it. It's going to impact people who care deeply about the right to abortion for sure. It will impact people who care deeply about the opposite viewpoint in perhaps a positive way, and that's a very challenging political issue in this country. I will say from the very sort of apolitical question of how will providers be impacted, I think the jury is still out on that. We don't really have a lot of good empirical evidence yet, but I think it's a reasonable prediction based on how we know doctors respond to much lower threats of liability from the medical actions that they take, that that the Supreme Court decision could impact doctors' incentives, could affect their likelihood to want to perform abortions in areas that are medically indicated. And so I think that it's likely that we will see some impacts there. Certainly, doctors will be thinking about these things, and they'll have them in the back of their minds when making those decisions. How impactful it ultimately is a question that we'll have to see. The other thing I'll just note as sort of an interesting research question is there's a lot of work by economists and others outside of economics that looks at the impact of Roe v. Wade on maternal outcomes, particularly with respect to education, family outcomes, sort of economic attainment. There's another issue here that has not really been explored, and it's something that I think people might look at, and it could make for some very interesting and I think impactful research, is to understand the implications of that law for men. So there's two partners here, right? And most of the emphasis has been focused on women, rightly so. But there could arguably be economic benefits to men who are able to do things in their lives that they otherwise would have done differently if they had a child that they weren't ready for. So that's another area of research that I think could be quite interesting to explore.
Nice. And I guess we're seeing the idea formation phase working in real time right here, right?
Yeah, yeah. I don't know what you're seeing in real time. You're seeing
Interesting.
something, yeah.
And I want to follow on with another question about the American health system. The public trust within the American health system fell during the pandemic. Why do you think this is, and how it can be restored?
Yeah, it's a good question. So my first question would be has public trust fallen? Like, has it really fallen? Uh, there's surveys that talk about these issues. I don't put a lot of trust in surveys. I mean, ultimately, what I want to know is, are the medical decisions that people are making now different than they would have made prior to the pandemic? And is it because of a lack of trust in the healthcare system? And how do we show that? It's really difficult to study because so many things changed during the pandemic that affected economic outcomes of people, healthcare outcomes and access of people. So much is changing. It's an attractive thing to think that, okay, well, all the political polarization around vaccines, around masking, around lockdowns could change people's trust in the healthcare system. It's certainly possible, but I don't think we have shown that yet. There was a study that just came out recently. It's not by me, but it's by others that looked at mortality rates between Democrats and Republicans in the U.S. during the pandemic, and they did something interesting. They looked at voter registration or donations, I think, and so they could identify individuals who were either registered as Republican or Democrat in this country, or maybe donated to one of those two parties. I can't recall how they identified party affiliation, but they did it in one of these two ways, which I think is credible. And then they linked it to mortality data, and they showed that prior to the availability of vaccines, there was actually no difference in mortality between Republicans and Democrats once you look at the same county and you look at people of the same age. So you take people of the same age, same gender, who live in the same county. One group is Republican, one group is Democrat. No difference in mortality rates between those two prior to vaccines. Then vaccines come about and you start to see an increase in Republican mortality relative to Democrats. And so there's two ways to look at that. One is, oh, okay, look, this is evidence of political polarization with respect to vaccines. Okay, that's fine. Maybe that happened. But the other interesting thing is, well, what was happening before? Because even before vaccines, there was a lot of political polarization about economic shutdowns and masking and social distancing, all that stuff. hugely polarized politically, and yet we didn't see any differences in outcomes or mortality outcomes between Republicans and Democrats. So to me, that suggests, and in the view of I've had for a while, is that there may be some differences, and there probably are some differences between Republicans and Democrats and how they view these issues related to the pandemic. But let's not lose sight of the fact that there's probably many more similarities between these two groups that we don't focus on. And I think it's important to keep sort of like keep that in the back of your minds, because it's attractive to point out differences in people when in fact the reality might be that the differences are actually small relative to the similarities.
True. And as a clinical physician, how do you feel about this polarization in medicine?
Um, I don't really think too much about it. As a physician, you see someone come into your office, or you see someone in the hospital who has a medical problem that needs to be treated, and you talk to them about why they do or do not want to get treated. I really don't try to involve politics at all into it. I just try to understand what it is about their situation, their beliefs that have led them to decide one thing versus another. Oftentimes, and this is just purely anecdotal, I find that a little bit of time goes a long way. Um, and this is, I think, very underappreciated, right? You can't expect to change someone's mind about something if you're not willing to, sit down and spend a little time to have a discussion. If you can't do that, then don't expect to change someone's mind, and don't place blame on them. The blame is squarely on you as a provider. So again, this is all anecdotal, but the limited discussions that I've had with people, they seem open to these issues.
Interesting.
Again, how does this play out on large scale? I couldn't tell you.
Going back to more micro insight from your career in life, while doing academic research and the Freakonomics MD podcast, what sort of different skills do you engage in these two different areas?
I think the research is there are some similarities between doing research and a podcast, in the sense, like, for a podcast that's targeted towards a general audience of people who are interested in issues around medicine and health, and at the intersection of economics. A framing is very important to figure out what is it about a research question or questions that people are going to think is the most interesting aspect of it. Storytelling is useful. I'm not a great storyteller, but I'm getting better, I hope. But that's also important. It's the same thing is true when you're writing a paper. You have to tell a story. You don't just present the findings. You have to have your own interpretation about them. You have to set out the question, say, all right, why is this interesting to analyze? And you got to do that in a way that convinces people to want to read further. And then when you're discussing what you're finding, you've got to do so in a way that is balanced, but also sort of tells the information in a way that is digestible by the reader. And the same thing is true for a podcast. So I think that there are similarities, and they all come in sort of the communication components of both lines of work.
Incredible. Finally, something we ask every guest on this podcast. What gives you hope?
I thought you were going to ask me for my social security number and credit card information. It's like, this podcast is running by itself. What gives me hope? Um, Medication. No, I'm just joking. Yeah, I mean, I think, a lot of things give me hope. The world is very different now than it was 30 years ago. I mean, this, look around. I mean, the access to technology that is available is so different. My grandkids can communicate with my parents, their grandparents. They could communicate with family in other parts of the world with a phone that allows them to see each other, right? That wasn't available 30 years ago, or much more recently than that, in fact, right? So the way that people are able to interact and communicate with each other is so different. Look at the medications that we have and the medical technologies that we have now compared to 30 years ago. Diseases that were deadly are still deadly, but they're less deadly. But we have a lot of ways to go in terms of making sure that we have better cures, better treatments, rather, and cures for diseases. So that's not to say that there's not a long way to go, but I think the world is changing. I wish I was part of the world 40, 50 years from now so I could see how it changed further. I might not be. And then, of course, chatting with people like you who are interested in the world. And, I look back when I was an undergraduate, I had zero interest in anything else besides completing my problem sets and, and going to school. Whereas the undergrads that I teach now, I teach a class at Harvard College, and it's amazing what the undergraduates now, at least the ones I teach, know. They know about public policy. Um, they know about the Affordable Care Act. I had no idea what Medicare was when I was or Medicaid when I was an undergraduate, and I ended up doing an MD, PhD in economics. So the people I teach, most of them are not going to do an MD, PhD in economics, and yet they know way more about the world. And I think part of that is because of the connectivity that we have with news and social media, and also just interest in people. So that provides a lot of hope.
Incredible. I really enjoyed the conversation. I really hope that our listeners do as well. Thank you so much for your time, um, and best of luck for your academic research going forward.
Perfect. And I will say the following: listen to Freakonomics MD. If you have trouble sleeping at night, it'll do the trick. It'll put you right to sleep. And be on the lookout for a book by myself and my colleague Chris Worsham. It's coming out next summer, and it's called Accidental Medicine. It's very similar to what you hear about in the show, and I think people will enjoy that.
Please do give a listen to Freakonomics MD, and when the book comes out, I really prompt you to go out and buy every single coffee you can.
Exactly. Yeah. Exactly. Yeah.
Thank you so much for your time, Bapu.
All right.
Really
Perfect.
enjoyed it.
So I'll talk to you soon.